Hi class, welcome to Module 10. Only one more module for the summer after this. Um, we've once again crunched two chapters together. In a normal semester, I'm able to give this as one module. However, in working on this and doing the research for the summer class, I think putting them together makes a whole lot more sense. Drugs and alcohol are a significant part of our crime issues. So as you look at this chapter, and if you noticed in the previous click above this, the objectives for this class, the student learning objectives, we're covering both, but I think that you'll hit highly on them as we go here looking at it. Now, drugs are a big part of our culture. They tie to our ethnic backgrounds. There's a number of things that come into place. You'll notice that I'm not going to go in to the perspectives here, theory-wise. Your film that you have for crime will do that in the much better way than I do. So I think it's interesting as we start to explore that. So let's look at the big issues here related to drugs and alcohol. There were no boundaries. Drugs were part of our culture in the early 1900s. I always think it's interesting when I'm teaching family. I tell the class about a drug, a bottle that was available in the drugstore called Mother's Helper, and in it contained cocaine, which helped children calm down and sleep, and made managing children better. Drugs like Benadryl were used to control behavior. Now we use that today, especially to control allergies and some of those relationships, but we're exposed to drugs on a regular basis. In fact, in the last module, I think I may have mentioned to you, I often call part of that discussion, Doctor, give me a pill, that we've come to this mentality that there are cures for it. Well, we started a war on drugs, and for the last 40 years, we've been fighting it. There's lots of reasons that drugs are more available today, including the fact that we've built trans-American highways and we're a global world. It's easier to get at things. But I think your movie will show you some of the issues, especially with the current heroin epidemic. But what's the social perspective? There are biological and physical theories that say that the cause of alcohol and drug abuse are within the individuals, that abuse is genetic or inherited, and the person can do little to escape their abuse. But this does not explain those social or structural issues. And that's why you're watching the films that you are with this particular chapter, to think about how we end up in this place. The perspectives, I'll let you review on your own, but you can see that drug abuse is likely to occur when society is unable to control or regulate behavior, that we need more laws. And we already know that that doesn't work. That there's a powerful group that decides what's legal and illegal, and we can look at the issues of opium dens in the 1800s and how we controlled the Chinese population by controlling their drug use. And then we look at even the opium wars of China, when a society was being tried to be addicted to drugs and they were trying to stop it, the power that comes into place. From the interactionist perspective, drug use is learned. And think about this, especially in the perspective of the use of tobacco and alcohol, that we learn it, and we can learn it through interaction and what goes into place. So what is drug abuse? That's using any drug or medication for other reasons than it was intended. And drug addiction is that physical or psychological dependence on the drug that we talked about earlier. So what are drugs? What are the major social problems we face with drugs? And we're not talking here just illegal drugs. One of the biggest issues is alcohol. And no surprise to you is that the addiction to alcohol, which we call alcoholism. No one's for alcoholism, but think about the use of alcohol and its adverse effect. We're dealing currently with the issue of the Penn State hazing issue, where what we're talking about there is binge drinking and how it really is significant in our society today. Heavy alcohol usage is highest among Native Americans, um, as Pacific Islanders, um, and, and whites. So we see this is very much tied to ethnic minorities. We see the stress that comes into place. And here's where, for some of you that may have started at the university and gone through an FYS course and you read the book, we did it for 2 years, about Indian reservations, the high rate of alcoholism in that. When we remove someone's dignity and the coping mechanism, they're often there with that high level of stress comes in place, and we cope through the use of drugs, especially alcohol. So, other risks related to alcohol is that women, their bodies themselves, do not process alcohol in the same way as men. They are risk for increased negative effects as far as their driving ability. Women who are not participating in the workforce are more likely to have excessive alcohol use, while as wife and mother can also come into play in this process. And then there are the issues that we've already mentioned of youth and alcohol, and that's the issues of binge drinking for college students, especially even high school students. Majority of people who begin drinking before the age of 15 are 4 times more likely to develop alcohol dependence. Adolescents who use alcohol are higher risk for social, medical, and legal problems, and underage usage is tied to fatal crashes and more problems within that. So much to think about. We could spend a whole chapter just on alcohol. When we explore other issues here, think about the tie to other criminal behavior that comes into place as well. Now, as far as abuse, what's interesting is we need to think about the use of drugs that are legal, tobacco and nicotine. Notice how we divide that out, because we now have vaping, which gives you the nicotine. Tobacco is the #1 drug that kills people. And according to the World Health Organization, 8 million people a year die of disease caused by cigarette smoke. Cigarette smoke is legal, and there is this war fighting back and forth as far as what it was allowed years ago. Tobacco companies handed out money on the Senate floor. Their lobbyists in support of the legislation. Cigarette smoking, it remains significant in this country, even though we've done multiple things to address it. Most people become smokers when they're adolescents. The adolescents that do become smokers have a more stressful environment. They have poor social coping skills. They often have examples from home of parents that smoke, so that you can see that's in place. They have their home environments may be less supportive. They have more conflict with their parents, and it's not the smoking that causes it, but look at the social issues that are coming into place here. We call it the brown plague. It's really significant, the health that it affects. Now bring this back to our last section when we looked at health, and we know that the increase of drug uses, especially tobacco and alcohol, are significant to the high cost of our medical care. Other drugs to explore here are marijuana, and you know that the current process is deciding in certain states whether it should be legal for recreational use. There's also the major chemicals that support children that are sick or other adults, especially. I've seen it very successful in working with cancer patients and allowing them to handle their cancer medications. People have found this very successful in dealing with AIDS medications as well. But again, this affects people's mental state and can be very problematic if they're driving with this impaired memory. There in the past was the belief that marijuana was the gateway drug to other drugs. Basically, that is a very minority of people who use marijuana. So part of the discussion with this really ties into you thinking about where this drug fits in our society, where it would fit within your thought, and should it be legal or not. Great point for a position paper, one way or the other. Other drugs highly out there, I usually show people a methamphetamine addiction because that so affects our own area here. Poorer people are more likely to have methamphetamine addictions. This was originally used as a weight loss drug. There's some real violent behavior that becomes out of it, and people who cook meth in their homes that will stay in the drywall. It affects their children at very strong levels and was our major concern until the current issues related to heroin. You can go through the rest of these. You're well aware of it. So what are some of the solutions and some of the problems here? Drug legalization is supported in many areas. Changes in public punishment or treatment. So much of our law and so many of the problems today are tied within this drug culture. You've seen major campus revisions teaching about issues that come into place, the model of binge drinking. Remember, even the issue of sexual abuse, rape, is often tied to drugs as well, especially alcohol. So significant issues as we look at this particular topic. Now, we're jumping right into crime because so much of drugs and alcohol issues are tied to crime, aren't they? We imagine that there's a lot of crime and violence, and yet violence is much more than that bloody, violent act out there. There is more crime in place related to other issues. So let's look a little bit about what crime is. Crime is any behavior that violates the criminal law, the laws that are in place. And there's theories on crime which will be gone over in your movie. Very great movie that covers it at a much deeper level and all the perspectives. So with that said, part of what you're doing in this chapter today, in this module, is to look at crime statistics and what's really going on out there. So as you're going to be looking at the FBI information here, you'll look at crime in the United States. This is the most current. This was just released this month. So I think that's a great part to look at. And you'll look at the percentage of crime and the change over categories. And you can see you have information by region and what's going on, the number of murders. We are in a very, are we up or down, violent crimes, and what's going on within it. The Federal Bureau of Investigation gives us great statistics and keeps those up to date, but they are only what is reported that goes into place. What's interesting is that we will see the prevalence of crime, and here you have the 2013 statistic of violent crimes. So violent crimes are 0.2%. Then we see robberies and much less. But the issue here is really these property crimes. And so things like identity theft are on a great rise and are the things that are more out there. So that's crimes of the property and crimes of theft that they fall under place. They can destroy your life through identity theft. So knowing the difference between the crimes, the difference of violent crime to the property crime, and then juvenile delinquents. Now remember, juvenile law was put into place after we had schools established. And so they deal with persons who are 7 to 17, and it looks at what goes into place here. And what we find is juveniles are more likely to be in crime as they are associated with those social conditions as they come into place. Again, I don't want to spend a lot of time on this because I think you'll find that the movie covers all of, a great deal of the things that are covered in this chapter, but especially want you to consider some of the social problems. The death penalty. Does it work? Statistics show it does not. That having the death penalty does not deter serious crime in committing murder. And yet we have a significant issue related to death penalty and the high cost. People think it's a high cost of incarceration, keeping people in prison for their life, but the appeals and the multiple legal battles that come into place are pretty significant. Another social problem is the new American prison. To reduce costs, we've privatized correctional institution and to save taxpayers money, which has resulted in some real problems. And prison reform litigation coming into place. Plus, we have the issues of prisoner rights. We spend more per day on a prisoner in a jail in the United States than we do on a student in a public school. So the high cost. Plus, we have another social issue of aging in prisons. So we go back to that aging chapter, and our correctional institutions are facing this aging in place, and prisons are now becoming almost at a nursing home level. Some significant social problems. Again, we're barely touching on the surface. So again, the sociology of deviance really goes into these particular issues at a much deeper level. But just to give you some idea. The PBS film, Chasing Heroin, is a new one for me to use in the course. It was just presented this spring, and I felt that it was a good tie for us to look at both the issues of how people face those social involvements that get them addicted to drugs or lead them to that process, and what can be done about them and how it's tied to crime. Hope you find this information helpful as you're going through these two chapters. You only have one discussion, and that discussion will be on the crime issue, and it brings you into exploring what can be done to reduce crime. You can easily see how that's going to tie in to the drug issue as well. And think beyond the new laws, what would you recommend based on the things that you've begun in this class? Looking forward to continued great discussions on this topic. Have a good day.